This is All India Radio. Good afternoon. I am Anuja Kumar and with me is Prashant Sinha with the Midday News. The headlines. Centre taking several measures to ensure smooth harvesting of Rabi crop and sowing of summer crop. Government exempts shops of agricultural machinery, tea industry and related services from the lockdown. Efforts are on across the states to implement Pradhan Mantri Garib Kalyan Yojana to help the poor during this ongoing crisis. Government issues order to make domiciles of Jammu and Kashmir eligible for all government posts in Union Territory. And World Food Programme says COVID-19 has little impact on global food supply chain so far. The centre is taking several measures to ensure smooth harvesting of Rabi crop and sowing of summer crop in order to ensure that farmers do not suffer from any adverse fallout during the lockdown period. More from our correspondent. Due to some technical fault, we couldn't get the bite. The Ministry of Home Affairs MHA has issued the fourth addendum to the guidelines issued regarding lockdown to fight COVID-19 to exempt shops of agricultural machinery and its spare parts. The fourth addendum issued by Union Home Secretary Ajay Bhalla exempted shops for truck repairs on highways, preferably at fuel pumps as well as the tea industry, including plantations with maximum 50% workers. The MHA said that social distancing and proper hygiene practices must be ensured in each of these activities. In the wake of the coronavirus outbreak, the Union Health Ministry has placed an order of about 10 crore hydroxychloroquine tablets from various pharmaceutical companies for healthcare workers. The Indian Council of Medical Research has suggested the use of hydroxychloroquine tablets only for healthcare workers and caregivers involved in the treatment and in direct contact with the suspected or confirmed COVID-19 patients. For those COVID-19 patients who require intensive care, the Health Ministry has suggested the use of hydroxychloroquine tablets in combination with azithromycin.
The Director of Indian Systems of Medicine, ISM J&K, after consultation with the advisor Ayurveda, Ministry of Ayush, Government of India, started supplying available Ayush drugs to all health workers, quarantine centres, old age homes, PRIs through Ayush doctors deployed in the state for management of COVID-19 activities. The step was taken after the LG GC Murmu had issued directions for providing Ayush drugs beneficial for self-care preventive health measures and boosting immunity for management of COVID-19 pandemic to all health workers, quarantine centres, old age homes, PRIs, etc. These Ayush drugs are helpful for prevention and symptom management of COVID-19-like illnesses and add-on interventions in the conventional care. As the country is fighting against COVID-19, the entire machinery of the Ministry of Petroleum and Natural Gas is working for smooth delivery of cooking gas to citizens. A report from our correspondent.
Over 8 crore Pradhan Mantri Ujjwala Yojana beneficiaries will be given LPG cylinders free between April to June. 15 port terminals, 195 LPG bottling plants and transportation network are currently operating every day despite lockdown and ensuring uninterrupted supplies of LPG in the country. Delivery boys and oil marketing company officials are doing commendable work in ensuring uninterrupted LPG supplies to all households. More than 60 lakh cylinders are being delivered every day. Petroleum and Natural Gas Ministry has advised officials to ensure that the delivery boys take all necessary health precautions. The announcement of the special ex gratia of 5 lakh rupees for LPG delivery boys and others involved in the supply chain has boosted the morale of the staff. With Dipendra Kumar, Anupam Mishra, AR News, Delhi.
The centre is taking several measures to ensure smooth harvesting of Rabi crop and sowing of summer crop in order to ensure that farmers do not suffer from any adverse fallout during the lockdown period. More from our correspondent.
For facilitating farm insurance, letters have been issued to all states to issue passes to representatives of concerned insurance companies for co-witnessing crop cutting experiments. Phytosanitary certification for export consignments and import releases of plant and plant products are continuing. For providing support to horticulture crops, necessary coordination is being done with growers, aggregators, wholesalers, mandi associations and state horticulture missions for smooth transport of the commodities and to sort out all difficulties. In lockdown period, Kisan call centers at all 21 locations are being operated by diverting calls to individual mobile numbers of farm tele-advisors who are now operating from homes. The call flow is about 15,000 to 20,000 per day. With Bhupendra Singh, Suparna Sekia, AIR News, Delhi.
The Council of Scientific and Industrial Research Institute of Microbial Technology has stepped up its efforts to take up COVID-19 sample testing. Director of IMTech Chandigarh, Dr. Sanjeev Khosla said the initiative of the Indian Council of Medical Research to involve all government-accredited labs is a welcome step and will be a game-changer in testing of COVID-19 samples. He said this would increase the testing rate.
A total of 601 new confirmed COVID-19 cases have been reported in last 24 hours, taking the total number of confirmed cases to 2,902 in the country. Health and Family Welfare Ministry said 12 deaths have been reported in the last 24 hours, taking the toll to 68 across the India. A total of 184 patients have recovered. Yesterday, Joint Secretary in Health and Family Welfare Ministry Love Agarwal said that during the last 2 days, 647 confirmed cases from 14 states have been reported from those who participated in the Tablighi Jamaat in Nizamuddin Markaz in New Delhi. He said these cases have surged the numbers of confirmed cases in the country. Joint Secretary in Ministry of Home Affairs Punya Salila Srivastav said that strict action will be taken against 960 foreigners who participated in the Tablighi Jamaat under the provisions of Disaster Management Act and Foreigners Act. She said deportation of these people will be done as per the standard protocol. She said blacklisting process has been started against those 360 people who have participated in the Tablighi Jamaat and returned to their countries. Dr. Manoj from Indian Council of Medical Research has said that 182 laboratories have been given approval so far to conduct the coronavirus testing. He said out of these, 130 are government laboratories and 52 are private laboratory chains. A total of 386 positive cases of COVID-19 have been registered in Delhi. Health and Family Welfare Ministry has confirmed that out of these, 8 patients have recovered, whereas 6 deaths have been reported so far. Delhi Health Minister Satyendra Jain has said that 259 people who have been tested positive participated in the Tablighi Jamaat Nizamuddin Markaz, Delhi. Nizamuddin Markaz has 67% contribution in total COVID-19 positive figures reported in the capital so far. Prime Minister Narendra Modi has said that the nation is united in the fight against COVID-19. The Prime Minister said people are at home during lockdown, but they are not alone as collective strength of entire country is with each one of them. In a video message yesterday, he urged the countrymen to switch off lights of their homes tomorrow at 9 p.m. for 9 minutes and light up diyas, candles or mobile flashlights to display the nation's collective spirit to defeat coronavirus. The Prime Minister said the country has to move towards light from the darkness created by coronavirus.
5 अप्रैल रविवार को रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा.
The Prime Minister also said the way people paid gratitude to those fighting against COVID-19 on the 22nd of last month has become a model that is being emulated by other countries.
आपने जिस प्रकार 22 मार्च रविवार के दिन कोरोना के खिलाफ लड़ाई लड़ने वाले हर किसी का धन्यवाद किया, वो आज सभी देशों के लिए एक मिसाल बन गया. आज कई देश इसको दोहरा रहे हैं। जनता कर्फ्यू हो, घंटी बजाने, थाली बजाने का कार्यक्रम हो, इन्होंने इस चुनौतीपूर्ण समय में देश को इसकी सामूहिक शक्ति का एहसास कराया। यह भाव प्रकट हुआ कि देश एक होकर कोरोना के खिलाफ लड़ाई लड़ सकता है।
In a tweet, Mr. Modi shared a video of former Prime Minister Atal Bihari Vajpayee reciting the poem "Aao Fir Se Diya Jalaएं."
दोपहरी में अधियारा सूरज परछाई से हारा, अंतरतम का नेह निचोड़े बुझी हुई बाती सुलगाएं, आओ फिर से दिया जलाएं। हम पड़ाव को समझे मंजिल, नक्श हुआ आंखों से ओझल, वर्तमान के मोह पाश में आने वाला कल न भुलाएं, आओ फिर से दिया जलाएं, आओ फिर से दिया जलाएं। आहुति बाकी यज्ञ अधूरा, अपनों के विघ्नों ने घेरा, अंतिम जय का वज्र बनाने नव दधीची हड्डियां गलाएं, आओ फिर से दिया जलाएं।
Citizens are advised not to use alcohol-based sanitizers while lighting diyas and candles tomorrow at 9 p.m. as it is inflammable.
Union Health and Family Welfare Minister Dr. Harshvardhan today visited the Lok Nayak Jai Prakash Narayan Hospital, New Delhi, to assess the preparedness to deal with the COVID-19 pandemic. Yesterday, the minister visited Ram Manohar Lohia and Safdarjung hospitals to take stock of arrangements made to tackle the COVID-19 cases. He praised the efforts of doctors, nurses, hospital management and sanitation staff, saying that they are working tirelessly to provide urgent relief to the patients.
भारत कोरोना के खिलाफ युद्ध में सफलता प्राप्त करेगा और सारा देश आपको, मैं समझता हूं कि जिंदगी भर याद रखेगा। आपका जो कंट्रीब्यूशन है उस पर देश को हमेशा गर्व रहेगा और सारे देश की निगाहें आपके काम पर लगी हैं।
Dr. Harshvardhan has expressed his concern over misbehavior with the healthcare professionals and urged people not to create hindrances in the duties performed by these healthcare professionals. In the wake of growing novel coronavirus cases in the country, the Health and Family Welfare Ministry has issued several advisories for the people to contain the spread of COVID-19. These advisories stress on several preventive measures like social distancing, personal hygiene, and restriction of mass gatherings. A report.
People should avoid participating in large gatherings. If a person is experiencing cough and fever, he or she should avoid close contact with others. People are advised not to touch their eyes, nose and mouth without cleaning their hands. Spitting in public places should be avoided. All persons should practice frequent hand washing with soap and water or use alcohol-based hand rub. In case of fever, difficulty in breathing and cough, a doctor should be consulted immediately. Swati Rakheja, News Desk.
In our series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Dr. Randeep Guleria, Director AIMS, suggested that at this time there is nothing better than staying at home to curb the spread of COVID-19 infection.
Today there is nothing better than staying at home for the safety of your loved one. Be part of the cure, not part of the disease.
This is All India Radio. Let's take a look at the headlines once again. Centre taking several measures to ensure smooth harvesting of Rabi crop and sowing of summer crop. Government exempts shops of agricultural machinery, tea industry and related services from the lockdown. Efforts are on across states to implement Pradhan Mantri Garib Kalyan Yojana to help the poor during this ongoing crisis. Government issues order to make domiciles of Jammu and Kashmir eligible for all government posts in the Union Territory. And World Food Programme says COVID-19 has little impact on global food supply chain so far. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
गांवों के सरपंचों के लिए कोरोना वायरस कोविड-19 से जुड़ी एक आवश्यक सूचना। दूसरे राज्यों और शहरों से वापस आए लोगों को कोविड-19 के बारे में ये जानकारी अवश्य दें। आपस में 1 मीटर की दूरी बनाए रखें। नाक, मुंह या आंखें अनावश्यक न छुएं। बार बार हाथ साबुन से अच्छी तरह 20 सेकंड तक धोएं। खांसते एवं छींकते समय रुमाल या कोहनी से नाक मुंह ढकें। कोविड-19 से बचाव के लिए आशा कर्मियों से सलाह लें। अधिक जानकारी के लिए अपने जिला मजिस्ट्रेट या मुख्य जिला चिकित्सा अधिकारी से संपर्क करें या भारत सरकार के हेल्पलाइन नंबर 1075 पर कॉल करें।
Efforts are on across the states to implement Pradhan Mantri Garib Kalyan Yojana to help the poor people during this ongoing crisis. Various banks in Tamil Nadu have started disbursal of funds for COVID-19 prevention and awareness activities. Lead bank authorities in Thanjavur have clarified that 500 rupees will be credited to each Jan Dhan Yojana account holder under the Garib Kalyan Yojana. They said that the current month's installment will be disbursed till April 9th. The bank authorities have requested Jan Dhan Yojana account holders to follow all social distancing norms while collecting the amount. Under the Garib Kalyan Yojana, 500 rupees will be credited into Jan Dhan Yojana accounts in May and June months also. In Leh, LG advisor Umang Narula has reviewed the implementation of the Pradhan Mantri Garib Kalyan package in Union Territory Ladakh. Advisor issued instructions to plan the distribution in a staggered manner in coordination with the police department. The Divisional Commissioner, Saugat Bishwas, informed that in Ladakh, all Antyodaya Ann Yojana and priority household beneficiaries will be provided additional 5 kg rice per person free of cost up to June. Additionally, 1 kilogram pulses per household will also be provided every month. He also instructed the Deputy Commissioners to start stocking up of the fair price shops of food, civil supplies and consumer affairs with adequate food grains from the respective FCI stores. Mr. Umang stated that direct benefit transfers will be made under the Pradhan Mantri Garib Kalyan Yojana and instructed the district magistrates to work out modalities for staggering of payments to the beneficiaries to ensure social distancing. He also advised banks to provide door-to-door payment to the beneficiaries in areas where banks are not available. He asked Director Social Welfare to ensure that the old aged, Divyangs and the widows should not suffer due to the current restrictions. Uttar Pradesh government is contemplating to provide 2 masks each to each and every citizen of the state. Today, in a meeting with higher officials, Chief Minister Yogi Adityanath said that no person should be allowed to go outside without masks during the period of lockdown once they have received the masks. AIR correspondent reports that Chief Minister also gave strict orders to the district magistrates in the state to ensure timely availability of food to the needy people.
Chief Minister Yogi Adityanath has said that food should reach timely to those people who have taken shelter or where administration is providing food to the needy people. He said that it is the responsibility of district magistrates to implement the timetable of lunch and dinner. He instructed that lunch should reach between 10 a.m. to 2 p.m. and dinner between 6 to 8 p.m. to the needy people. Otherwise, action will be taken against the officials. The state government is also thinking to provide 2 masks each to every citizen of a state. These triple-layer masks will be made from khadi and people can wash them after use. People in rural areas are also advised to cover their faces with the help of gamcha or a small cotton sheet. Sushil Chandra Tiwari, AIR News, Lucknow.
Chief Secretary of Uttar Pradesh R.K. Tiwari has said that state is fully prepared to deal with any situation related to the spread of COVID-19 and have all the preparations related to the availability of bed and ventilators. Talking exclusively to AIR Lucknow correspondent Sushil Chandra Tiwari, the Chief Secretary said that state now has 3-tier category of hospitals and more than 6,000 beds.
कोरोना से निपटने के लिए बड़ी व्यापक तैयारियां की गई हैं। इसके लिए 3 स्थानों पर कोविड अस्पताल बनाए गए हैं, जिनों के अंदर CHC लेवल पर लेवल 1 के अस्पताल हैं। जिला स्तर पर मेडिकल कॉलेज और बड़े अस्पतालों को कोविड अस्पताल बनाया गया है और इसके अलावा लेवल 1 के जो स्पेशलिटी लेवल के अस्पताल हैं उनको स्टेट लेवल पर कोविड अस्पताल बनाया गया है। अब तक लगभग 6,000 से अधिक आइसोलेशन बेड्स का इंतजाम किया जा चुका है और लगभग 12,000 क्वारंटाइन बेड्स को भी चिन्हित किया जा चुका है। इसमें निजी मेडिकल कॉलेज को भी आइसोलेशन वार्ड बनाने के लिए उनका सहयोग दिया गया है।
The Chief Secretary said that the spread of COVID-19 in the state was initially at level 2, but now due to the spread of members of Tablighi Jamaat, the number of patients has increased, but it will be controlled. On the issue of misbehavior with health workers and attack on police teams, the Chief Secretary said that National Security Act will be imposed on such people.
जनता से हमारी अपेक्षा है कि हमें पूरा सहयोग प्रदान करें और सहयोग मिल भी रहा है, लेकिन कुछ लोग जैसे आपने बताया जो पुलिस के साथ या स्वास्थ्य कर्मियों के साथ या किसी भी ड्यूटी पर तैनात हमारे व्यक्तियों के साथ कोई दुर्व्यवहार करते हैं तो कानून के अंतर्गत कठोरतम कार्रवाई उनके खिलाफ की जाएगी।
Mr. Tiwari also appealed through the network of All India Radio to the people of the state to cooperate with the government and follow the lockdown.
In Gujarat, 10 fresh cases of COVID-19 were confirmed today. With this, the total number of COVID-19 cases in the state has gone up to 105. One death was also reported in the state today. A report from our correspondent.
State Health Department informed media that 10 fresh cases reported today include 5 from Ahmedabad, 2 each from Bhavnagar and Gandhinagar, while 1 from Patan. Principal Secretary of Department of Health, Dr. Jayanti Ravi, said 67-year-old lady who was tested positive for COVID-19 died in Ahmedabad today. She said so far 10 deaths have been reported from the state due to coronavirus. Ahmedabad remains the hotspot for the COVID-19 cases, as more than 40% of the total cases were reported from Ahmedabad only. Meanwhile, 4 COVID-19 patients were discharged today after full recovery. Aparna Khun, AIR News, Ahmedabad.
Coronavirus cases in Maharashtra have surged to 537, with 47 new cases reported today. Mumbai has become the COVID-19 hotspot with the most, 28 new cases. The Maharashtra government is taking all necessary measures to help the poor and needy people and to streamline the supply of essential and non-essential items in the state. More from our correspondent.
The Pradhan Mumbai Municipal Corporation declared 5 hospitals as dedicated facilities for treatment of COVID-19 patients and another 6 as isolation centers yesterday. Kasturba, St. George, Seven Hills, Saifi and Nanavati Hospital will work as dedicated COVID-19 hospitals. The civic body issued SOPs for the treatment of COVID-19 patients and decided to admit the patients above 60 years in the dedicated hospitals on priority basis, while the other patients below 60 years of age and asymptomatic patients will be kept at the isolation centers at Nagpada, Bandra, Andheri, Powai and Shivaji Nagar. The Taj Group has also joined hands with BMC and has made special arrangements in the luxurious hotel for the doctors engaged in the COVID-19 treatment. Central Railway is also busy in converting the ICF coaches into isolation wards at 2 workshops in Parel and Matunga. Meanwhile, the state government is ensuring the food and vegetable supply to the prominent cities including Mumbai, Pune and Nagpur. The government is also making the arrangements to supply the vegetables and fruits to retail sellers. Shailesh Patil, AIR News, Mumbai.
In Madhya Pradesh, the state government has issued directives that orders, correspondence and approvals issued through official emails would be considered valid. As per the order issued by the General Administration Department, it is stated that the order and approvals issued through official emails will be considered valid till the 15th of April. More from our correspondent.
The number of corona-infected patients has increased to 154 in Madhya Pradesh. Indore has 112, the highest number of patients. So far, 9 people have died due to corona infection in the state. A 36-year-old government employee died today. He had tested positive for coronavirus in Chhindwara town. Meanwhile, a London-returned woman who was the first person to test coronavirus positive in Bhopal and her journalist father, also a COVID-19 patient, have been discharged from a hospital after their repeat samples tested negative. Sanjeev Sharma, AIR News, Bhopal.
The Bihar government has started screening of over 1,80,000 people again who had come from outside after 22nd of March. Chief Secretary Deepak Kumar said that this decision has been taken in view to stop spread of coronavirus infection at community level. Mr. Kumar said there will be further investigation in case of any symptoms. A report.
During the first phase, people who had come to Bihar from Maharashtra are being screened. In second phase, the people from Kerala, Tamil Nadu and Delhi will be screened. Screening of people will be completed within 6 days. Suspected persons will be sent for isolation. The district magistrates have been instructed in this regard. Screening of people who had come from foreign countries had already been completed. Over 27,000 migrant laborers have been kept in home quarantine for 14 days. 3,200 quarantine centers have been made near their villages. They will be kept in isolation ward if situation worsens. Activities of migrant laborers are being monitored to contain coronavirus infection. With KK Lal's report from Patna, Vasundhara, AIR News.
In Assam, the first COVID-19 positive case has been reported in Guwahati. Officials in the National Health Mission said that the building where the patient stays has been sealed and the family members are also put in isolation. In Mizoram, the state government has decided to disburse 118.55 lakh rupees from the Chief Minister's Relief Fund in the fight against COVID-19. The decision was taken at a meeting of the Committee on Utilization of Chief Minister's Relief Fund at Aizawl yesterday.
In Karnataka, 128 COVID-19 positive cases are confirmed till now, with 11 discharges and 4 deaths. The fourth death was reported from Bagalkot yesterday. The central government has put out an advisory on minding our minds during the COVID-19 pandemic and forced lockdown. It has advised people to involve themselves in creative activities to cope with emotions or boredom during the lockdown. Our Bengaluru correspondent has sent the story on how children are dealing with their time during the lockdown. More from our correspondent.
The schools are shut and all out-of-home activities and social interactions have stopped. Keeping kids engaged with creative activities that they find interesting is tough. There are some taking music lessons using YouTube. Several digital platforms such as BrainPop, Duolingo, Khan Academy are popular among Indian parents for kids to learn a new language, skill, or knowledge. One such company offering educational films on learning maths online is Byju's. Its Chief Content Officer, M.R. Vinay, has spoken on how the platform is helping kids caught up with the lockdown.
Taken two initiatives. One is existing app that we had made it free for all students till the end of April. Second thing is we are also introducing a home learning program for students, mainly designed for class 4 to class 12 students. So class 4 to class 10 will study for their board exams and their regular exams. 11th and 12th standard students can study for both their board exams as well as competitive exams. It's actually time for you to strengthen your concepts further, make your fundamentals a lot stronger.
Such platforms are helping children with a lot of spare time to engage in learning activities and cope up with the lockdown boredom. Sudhindra, AIR News, Bengaluru.
In an extremely proud moment for Kerala, the elderly couple aged 93 and 88 years old were discharged yesterday as they completely recovered from the COVID-19 infection. They are India's oldest COVID-19 survivors.
People across the country are following government's appeal to stay in their homes during the lockdown period. To deal with the present situation, people are engaging themselves in different activities like completing their household chores, playing indoor games, reading books, doing gardening, and pursuing their hobbies. We spoke to a couple of people who shared how they are utilizing their time during the lockdown.
I am Shruti. I'm from Meerut. I have been doing many things during the lockdown to keep myself fit. I do yoga. I also read books and newspapers online. Besides, I do other productive things. People can also try painting to keep themselves engaged.
I am Ron. Ever since this lockdown started, I've been trying to catch up with family members and friends on the telephone, trying to figure out what everybody's up to. Earlier, I believe I didn't have much time to do that, but now it's nice catching up with all of them. And I've also been catching up on some much needed reading which I had to put off earlier due to my work schedule. I'm keeping myself busy.
Vice President M. Venkaiah Naidu complimented IIT Roorkee and a startup at IIT Hyderabad's incubation center for developing low-cost portable ventilators called Pran Vayu and Jeevan Light. In a tweet today, he said such innovative solutions are the need of the hour. The World Food Programme, WFP, has said that the rapidly growing novel coronavirus pandemic is so far having little impact on the global food supply chain, but that could change for the worse if major food importers remain anxious. The UN agency said global markets for basic cereals are well supplied and prices are generally low.
The government has issued an order to make domiciles of Jammu and Kashmir eligible for all government posts in the Union Territory. The Ministry for Home Affairs has issued the order for making necessary changes in the laws to facilitate the application of central laws to the newly formed Union Territory of Jammu and Kashmir.
And now, before we end, the headlines once again. Centre taking several measures to ensure smooth harvesting of Rabi crop and sowing of summer crop. Government exempts shops of agricultural machinery, tea industry and related services from the lockdown. Efforts are on across the states to implement Pradhan Mantri Garib Kalyan Yojana to help the poor during this ongoing crisis. Government issues order to make domiciles of Jammu and Kashmir eligible for all government posts in Union Territory. And World Food Programme says COVID-19 has little impact on global food supply chain so far. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts. And with that, we end the Midday News.